arytenoid is sort of an important one because the arytenoid cartilage and the thyroid cartilage actually are structures which anchor the vocal cords. And so those are kind of ones you should probably try to remember. So thyroid, cricoid, epiglottis, of course, is very simple, and it's arytenoid, which is an anchor point. A couple of good pictures here in your book. I'm going to use this again in just a second. So here's the thyroid cartilage and the laryngeal prominence, the Adam's apple. Below it is the cricoid cartilage, and then we start the trachea, and we'll get to the tracheal rings in just a minute. They are also cartilage. If you look at from a posterior view, this big thing looks like a tongue. It really does, doesn't it? That's the epiglottis. You can see the arytenoid cartilage here in the back, and also the vocal ligaments, which are anchored in part by the arytenoid cartilage. So there's another slide which is going to be next, which shows this in a little bit more detail. So this shows you some of the structure of the larynx, a very complicated, important structure. If we look at this one, this is a particularly good one. Here's the epiglottis. Here's the thyroid cartilage here. Here are the vocal. There's a couple of confusing things here. There's a structure called the vestibular ligament, and another structure below it called the vocal ligament. The vestibular ligament also go by the name of the false vocal cords. They're sort of protective structures. The vocal ligament are better known as the vocal cords. And you can see they're sort of anchored here from the arytenoid cartilage to the thyroid cartilage. And when you produce sound, of course, the air is coming up the trachea from the lungs, causes this structure to vibrate and produces sound. Now, yeah. I'm sorry? These guys that you'll see in a second, the vocal ligaments sort of are structures which lay kind of beside and kind of a little bit on top of the vocal cords, so they tend to protect it a little bit. There's a better picture in just a second. So the vocal ligaments don't produce sound. Vocal cords, the vestibular ligaments, the false vocal cords, because of their name, false vocal cords, do not produce sound. It's the bottom pair here, the vocal ligaments, which are the ones which vibrate. So those are the ones I've been having a little trouble with. I had this throat thing. I don't know what it is. It's getting better, believe it or not. But the more I talk, sort of the weaker my voice gets, because the more you stress the vocal cords, they can get inflamed. They lose their elasticity, and when they lose their elasticity, you lose your voice. At least hopefully only temporarily. So that's why, sometimes you have to rest your voice. So I get a week off to rest my voice between the end of the summer and the beginning of the fall semester. We'll see if it works. So how do you make sound? Well, the larynx, this area right here, when you talk, you can feel it vibrate. It's called the voice box. Vestibular and vocal ligaments are found in the larynx. I've already told you the anchor point. The vocal ligaments are elastic and vibrate, and they're called the true vocal cords. So the ones that make sound with. And the false vocal cords, you'll see the picture of it in just a second, which kind of lie in a different sort of above, although it's probably not exactly correct, don't produce sound, but they're called the false vocal cords. It's like, well, why bother if they don't do anything? Well, they're there, so we got to talk about it, right? So that's how sound is produced. It's just vibration. And your brain picks up the vibration and translates that into a language you understand, which I think is very cool. Now, one of the things that I'd like to mention about sound production, this is extremely simple, we all know this, is that if you want to make a loud noise, if you want to raise your voice or yell or scream or something like that, you have to push more air across the vocal cords. They have to vibrate harder in order to make a louder sound. Right? When you whisper, of course, the amount of air going across them is very small. Right? So it just depends on how much they're vibrating. And it's simple, when it comes right down to it. So it's just the vibration of the vocal cords picked up by your brain. It's like, oh yeah, that's a language I understand, or not. With me, anything in English is not. Okay, so here's the picture. Let's see if we can see how this works. So here's the vocal folds, and here's the vestibular folds, and here's the glottis. So these are little things that are vibrating. These are the structures which are kind of off to the side, which are the vestibular folds, which are not vibrating. they're just structures. In a way, they almost help anchor the vocal cords in a way. So when the glottis is closed, you can see here's the vocal cords and the vestibular fold, the vocal fold. It's all closed. You're not making any sound. It's closed. When you're making sound, it's open, because if you're going to make sound, you have to be able to push air out of the glottis. If you're not going to make any sound, then there's no air coming out. Not making any noise. This is a picture of what it would look like through like a laparoscope or something like that. So I guess if I looked at my vocal cords, I probably wouldn't see any difference in them right now, but you know, a couple of days ago when I was really having trouble with my voice, they were probably, who knows, maybe they were inflamed or something like that. And you know, people who do things like sing for a living and stuff like that have to know the sort of, I don't know, capacity of their voice, how long they can do it, how much rest they need, and that sort of stuff. Because over time, you know, your voice can definitely, you know, change and suffer over time. So anyway, so those are the chords. Vocal cords, vocal folds. Pretty simple, really. The windpipe is the one more. The windpipe is basically this structure my hands around it, right? The trachea. It's the passageway for, well, that's probably a little big, right? Moving on. Anyway, so it's the passageway to the lungs, about 1 inch in diameter. It says, you know, 4 1/4 inches long. Apply that. It consists, I don't know if you can count them, I guess. These are the tracheal rings. They're hyaline cartilage, but they don't go all the way around. They're C-shaped. I have a picture of these. The epithelium, the SCC, stuff, saw that earlier this semester. And right where the trachea divides into the primary bronchi, there's a little, like, last kind of hyaline cartilage ring right here. It just gets a name because it's the last one. It's called the carina. So it's just this very last one before we divide into, remember, anatomical position. This is the right primary bronchus. This is the left primary bronchus. The right primary bronchus is a little bit more of a straight shot. Kind of, you know, if you drop something in here, it might be 50-50 for where it's going to go. But if you drop something down here, it might rattle around a little bit. Because this is a straighter shot, it's likely to drop kind of into the right side or something. It's able to drop in there. The left one has a little bit more of a curve to it. So we'll get to these in just a second. So this one looks like divides into the right and left primary bronchi. So here's the PSCC. This is the line epithelium. I know I've mentioned this to you, and I want to do it again just because, well, many of the schools have started already. The elementary school down the street from me has already started. I guess the high school will be starting pretty soon. But the schools are required to be pretty strict this year, 7 through 12 at least, about requiring the whooping cough vaccination.